Good afternoon. Thank you for joining us for our Cancer Conversation series brought to you by UNC Lineberger and Rex Healthcare. My name is Jennifer Potter and I will be your moderator today. Today's presentation will be about better understanding the health effects of vaping. We're delighted to have Dr. Hiram Mehta join us today. Dr. Mehta is a pulmonologist with Rex Healthcare in Raleigh. Before we get started, I want to bring your attention to an email address we have for questions. It's on your screen right now, cc@med.unc.edu. If you have any questions about today's topic, please don't hesitate to email them. We'll answer them at the end of Dr. Mehta's presentation. Without further ado, I'll turn it over to Dr. Mehta.
Hey, how are you guys doing? Thank you so much for inviting me. Okay. So this is a great and exciting topic. I'm excited to talk about it, and I really appreciate being invited to do this talk. So one of the things I'm going to start with is I'm going to start talking about the learning points here, what I want you to take home today. So one of the big things is I want you to learn about what vaping is. I want you to understand how e-cigarettes and vaping have become increasing over time and are on the rise at this point. And then just learning about vaping, its link to heart disease and asthma, COPD. How is it linked to cancer, if it's linked to cancer? And we'll get into all of that. And that's what I want you guys to take home today. So big part of this is knowing the terminology. And I'll tell you what, I get patients in my office, just in fact this week alone, I've had people present new terminology to me that I don't even know, and I have to Google and look it up. But it's good and it's important to understand the terminology. So let's start with that. So e-cigarettes basically come in lots of different shapes, different sizes. And you can tell from the slide here, you'll get things called e-cigs, e-hookahs, mods, vape pens, vape tank systems, and ends. These are all different terminology for the same thing. It just comes in different shapes, different sizes, whether it has an attached battery or not. So there's a lot of different various different contraptions, but they all are the same thing. And when you use an e-cigarette, the actual act of using an e-cigarette is called vaping. So then how do e-cigarettes work? So then basic components are three major components from e-cigarettes. You have a battery, the power source. You have the atomizer, basically the heating source, and then you have the liquid, which is the liquid nitrogen plus the other chemicals and flavoring and all that go in there. You have the battery power the heating device, which turns the liquid into the aerosolized version, which is what people will inhale. So then what's in the cigarette vapor? So you have to ask yourself, what is in that liquid stuff that we're inhaling? So there's several items, and I think we're learning every day about what's in some of this liquid. So one of the big properties you'll see is nicotine. Nicotine is what's in cigarettes, in the patches that you guys have probably heard of. It's the key component, the addictive component of cigarettes. It's the thing that most people crave. But other than nicotine are the other chemicals. There are these organic chemicals that are found to be just very irritable to the throat. That's how you get sore throat and cough when you vape. There is flavoring. So one of the big topics I'm sure you guys have heard on the news is something called diacetyl or popcorn lung with e-cigarettes. But some of you may even remember with food processing plants, mainly popcorn, that got a lot of news press before. And I'm going to go over that later in the presentation and go over a slide with that. There's other chemicals, ultra-fine particles, which aren't even in cigarettes or in e-cigarettes, that get past your lungs filtering system, which is concerning. And then there have been studies trying to show some cancer-causing chemicals that are found in these liquids. So then, you have to sit back, and a lot of you probably listening to this talk have thought of yourself, I myself have thought about it myself, is history repeating itself? Does this feel familiar? And you have to look at this slide, which I think is a great ad. This is an ad from 40s and 50s, where this is a classic example of how big cigarette companies used to use misleading ads and false advertising to improve their brand's appearance, to kind of commercialize the use of cigarettes. Although I'll tell you that doctors did smoke in the hospitals, in the waiting rooms, everything. In fact, I have a patient who always tells me how she remembers a doctor smoking while he was delivering her baby. So in fact, it happened, and they didn't know a lot about it back in the day. But so you bring that back to now, and this is a great comparison of how ads are targeting certain populations and certain demographics, and it all feels really familiar. So before, back in the 40s and 50s, when cigarettes were coming up and just popularizing cigarettes, you can see one of the big things they used to use is the cowboy look, the rugged young man, just the sex appeal that they used to use to help bring in that demographic, the young adult population, to come in. And then here on the right, you see Blue, which is a very popular e-cigarette, showing a very similar ad of a young, good-looking, rugged gentleman smoking their e-cigarettes. So again, another great example of how we're trying to reach that demographic, how we're trying to popularize the brand and the product itself. Back in the day, you see kind of a relationship, romantic, and then you bring that back to now, and you see that as well, where they're just trying to improve their brand appearance, and they're trying to track that demographic. So how big is this problem? Is e-cigarettes on the rise? Is it growing? Well, it is. And before I go over this slide, we have to understand our history, right? And so cigarettes, the history of cigarettes, which basically started in the 1900s. It was initiated then, quickly came to rise with World War I and II, where they just started having a big rise in smoking. There was a huge incline in the usage of cigarette smoking. It wasn't until about 40 years of cigarette history until we started realizing cancer risk with cigarettes. And it wasn't 20 years even after that, almost 60 years before the conception of cigarettes, we started having medicine catch up and start making formal statements against cigarette smoking. So here we are now with e-cigarettes seeing a similar rise. From this graph, the whole point of the graph was to show you how now it's rising. In 2011, remember, e-cigarettes are young. They're just in its infancy, less than a decade since its conception. So you see in 2011, you see almost 7 million people globally were using e-cigs. That came up to around 35 million in 2016, and it's expected to go up to 55 million by 2021. So there is a very eerie similarity in terms of the rise of cigarette and e-cigarette in terms of usage. So what's more alarming at this point is the demographic. So these ads that I showed you earlier, they're working. They are catering to our young adults. So the fastest rise we're seeing is amongst this population. So there was a big study that released in 2018, survey looking at kids who smoke. It showed that 3.6 million kids in middle school and high school claimed that they had used e-cigarettes within the past 30 days. That's about 4.9% from middle schoolers and about 20.8% from high schoolers. And this was a steep incline since 2011. So that just shows that they're reaching out to the right population for these companies and these product owners. So then, it's a pretty busy slide, and I'm going to kind of go over it bullet by bullet and try to show you the link between the early links that we're starting to create. Now, my disclaimer here is e-cigarettes are new, and we don't have a lot of information. Not a lot of studies have been done with e-cigarettes and vaping. And remember when I said 60 years of information was required before medicine could catch up and realize the links between health problems and cigarette smoking. So it takes time to determine those kind of health risks with even vaping. But early studies are starting to show some concerning findings, okay? So let's take the first one here. So risk of heart disease. So there was actually a really big study released by UCSF. It looked at over 70,000 people, surveyed smokers, 70,000 smokers, and what it showed was patients or people who used e-cigarettes on a daily basis were 2 times more likely to have a heart attack than someone who had not used an e-cigarette. To put that in perspective, smoking increases your risk 3-fold. So it's very similar to smoking at this point. And the combination of the two, which the study in itself showed as well, that were more popular was cigarette smokers used e-cigs as well. And the combination of the two actually created a higher risk of heart disease, and it was 5-fold when you combine the two. So that's alarming. So then the next point, which would be COPD. So for those of you who don't know what COPD is, COPD is chronic obstructive pulmonary disease. This is a chronic smoker's lung. It's the damage that you get from chronic inflammation that smoking does to your lungs. Many of you may have coworkers or family members that have COPD. So there hasn't really been a formal study that has linked e-cigarette use and vaping to COPD yet, because remember, it's still too new. It takes time for that to develop over time. But they did do mice studies where they looked at lung tissue damage, and it shows that the inflammation from the smoke itself and the chemicals, and you can tell, remember we talked about the small little particles that can get through your lungs filtration system. A lot of those cause inflammation in your lungs. That's what the filtration system was built to do, was protect your lungs. Well, if you have particles get past that, it's going to cause inflammation. That inflammation over a long period of time can cause that risk of COPD. So the theoretical risk of COPD is there, and that is concerning. So then the other one, the third point would be asthma. So you think about asthma, a lot of you may know family members with asthma. You've heard the word asthma. It's basically a small airway disease, typically found in young kids, can be seen in adulthood. A lot of times these people have very sensitive airways. And so when you introduce e-cigarettes, how does it affect them? Well, they did a study. It was out of South Korea, a big study, looked at thousands of kids, and again, it was a survey study because you can't do like a forward study yet because it's just too young. But it looked at surveying young kids and to see how it impacted their asthma and their actually respiratory symptoms. And it showed that the teenagers and young adults that smoked were more likely to have missed school days from smoking e-cigs and had more symptoms of their asthma. Then there was a great study that was released by the NIH health study that looked at, guys, this is the 4th and 5th point here on the slide, that looks at the link to e-cigarettes and transitioning to smoking. That's a big question a lot of people have, because you can turn that question around, which we'll talk about later, and I'm sure you guys will have questions about, is can I use e-cigarettes to help me quit smoking? And so this study was neat in terms it showed non-smokers who picked up e-cigs and started initiating smoking through e-cigarettes and vaping were definitely at a greater risk of initiation of cigarette smoking, and they were at a higher risk to become lifetime smokers. So that was an alarming result of that study, to show that actually it's the other way around, that those that never smoked picked up e-cigarettes and actually ended up becoming lifetime smokers of regular cigarettes. And so then the lastly, which is kind of what the topic was about, but again, there's not a lot of cancer research with e-cigarettes and vaping yet, but this was a great study that shows some initial framework that we needed. So this looked at basically a study that came out looking at mice models and lung tissue, human tissue. And it looked at, well, if we introduce vaping and e-cigarettes to these, does it increase your risk for cancer? So what they showed was it actually, the smoke and the chemicals and that aerosol that we talked about, it did cause significant DNA damage. Now, for those of you who don't know DNA is the framework, it's your genetic makeup cellular makeup. And a lot of times, when you damage that DNA, that's that link to cancer. Over time, damaged DNA has that risk to become cancer. So this was the first study that showed and made that link between e-cigs, vaping, tissue damage, DNA damage, which brings up the possibility of cancer risk. It doesn't mean it causes cancer, it means that it is likely a cause. Eventually, over time, we would see it cause cancer. And in that study, it was lung and bladder was the biggest risk. Moving on. So then, bringing it back to, so we talked about all the different types of things, and then the one big one I wanted to focus on that gets a lot of publicity is popcorn lung. As a pulmonologist, this is also very concerning to me. Popcorn lung is a fancy name given to something called bronchiolitis obliterans. It's a form of lung disease. Now, how this came about was about a decade ago. They started seeing food flavoring, especially at a popcorn factory, causing significant lung disease. And they linked it to a chemical called diacetyl. And that in itself, after a study released by Harvard, was found to be in 39 of 51 brands of e-cigarettes. So the FDA has regulated how much diacetyl food flavoring can contain in food, but we haven't even reached that with e-cigarettes yet. And you'll see a lot of these brands contain this chemical that has the risk to cause this bronchiolitis obliterans and cause lung disease long term. So then, what can we do about it? What's been done about it? And briefly, and without going into a lot of detail with this, the FDA has stepped up. With all of these studies, and remember these studies are new. I mean, we're seeing studies basically within the last 2 to 3 years that shows there's some risk of using e-cigarettes now. So the FDA has stepped up, and a lot of regulation is being passed. One of the big things is the flavoring. Remember we talked about the popcorn lung, the diacetyl chemical. It's that flavoring in e-cigarettes that we don't know a lot about and the chemicals that are contained in it. And so they're starting to regulate how much flavoring and what type of flavoring we put in e-cigarettes. The other thing that, and it's not on the slide, but the other thing that they've really started regulating, just like cigarettes, they're regulating the age, greater than 18. You have to have a license. They're trying to keep these e-cigs out of vending machines and things like that to try to get young adults not have so much accessibility to it. And so I think there are some strides being made a lot earlier than we did in cigarette smoking. So we're learning from our lesson, I think. So why is this important? Why are we talking about this today? And I think it's new, and I think e-cigarettes has gained a lot of popularity over time, and I get that. But the important part of this is cancer risk. We don't know the cancer risk, but the potential is there. And if you take e-cigarettes out of the picture and you just look at cigarette smoking alone, it is the dominant cause of lung cancer. You see in the slide here, it causes more cancer in males than colon, prostate, and pancreas together. It causes more lung cancer, it causes more death from lung cancer in females than any other female organ combined. So it's alarming. And so lung cancer right now, even without the e-cigarette component, is astronomical in terms of numbers. So to put that in perspective, so we talked about the deaths in lung cancer. That's basically saying 158,000 deaths a year from lung cancer. And that's a 747 plane full of people die from lung cancer every day. And that's why the problem is real. And that's why it's so serious. And so anytime you introduce something new to an environment that grows this fast, you have to slow down and you have to take a step back and say, is this going to increase these alarming numbers as they are now? Are we introducing a whole new segment of cancer-causing agents? And that's where I put this up, just for folks to understand what are the causes of lung cancer. Well, so we talked about smoking. Smoking is the biggest part of it. 80% of lung cancer is related to smoking. There's 20% that isn't. And that chart right here, you can see several radon, asbestos, there's several other causes of it. But then you have to ask yourself, is e-cigarettes, vaping going to be a number on this diagram? And that's where the concern gets to, starts playing a role. So prevention is key. I always like putting this in my presentations because there's a reality to this. And when you smoke cigarettes at this time, you know your risk. There's a lot of literature that's been presented. There is no debate with cigarette smoking and lung cancer risk. The debate now is whether e-cigarettes are causing lung cancer or any type of cancer right now. Remember that study we talked about that causes DNA damage links it to lung and bladder. And so you have to talk about prevention, whether it's with cigarettes or e-cigarettes. So then I know on a lot of people of mine in my clinic, my patients alone, big question is, can I use e-cigarettes to help me quit? I think the answer has been clear. Right now the FDA does not approve e-cigarettes as a use of modality to help you quit. We still go with the traditional stuff that you guys have all heard about. And these are the options that I've put up there for you, the quit options. Medication options, nicotine replacements like nicotine patches, gums, lozenges. Medications, you've heard of Chantix, I'm sure, before. Those are the other options to help you quit. Counseling, don't undermine the strength of counseling and 1-800-QUIT-NOW, which is a hotline to help you quit smoking. And then, you know, I know there are folks that will do cold turkey, but e-cigarette is not approved to quit smoking. Sorry. So to wrap it up, there are a lot of risks, and we're starting to see several risk factors with e-cigarettes. They're early, they're new, we don't know a lot yet. We're starting to see a lot of links to, remember, heart disease. You're 2 times more likely for that. Asthma flare-ups, COPD long-term down the road, and now even cancer risks with that DNA damage that the study showed. And so prevention is key. I think we have a lot to learn about e-cigarettes. But I think it's important that we understand that there is already links to some risks now.
Thank you, Dr. Mehta. That was a wonderful presentation. I'm sure our audience appreciates all the knowledge that you shared on this new topic. While you were speaking, we did have a question come in, and I'd encourage anyone who has follow-up questions to use the address that you see now on your screen. Someone asked, my husband vapes with the electronic type device. He usually gets fragrance liquid. Is there a secondhand risk to me and my young child?
That's a great question. So the unfortunate part is we don't know. Theoretical risk is there. It's the aerosolized version of that cigarette that you're actually breathing in. And so a lot of questions that haven't been answered are, what's the distance of that smoke spread? Can people get secondhand conditions like the primary smoker themselves? If you use literature from cigarette smoking, definitely. In fact, they're even talking about third-hand smoke, which is smoke that gets stuck in particles of clothing or areas like that that get passed on. So the theoretical risk, again, is probably there, but we just don't know enough to firmly say that there is a link to second-hand e-cigarette exposure.
Okay, thank you.
Yeah.
We have another question. What would you say to someone who argues that e-cigarettes are less addictive than traditional cigarettes?
So that's a good question. All right, so the addictive property is the same actually, right? Because cigarettes have nicotine, e-cigarettes have nicotine. That is the addictive property. They both have it. So I would say that basically you're looking at a very addictive product. In fact, that study we talked about earlier showed that those that picked up e-cigarettes continued it and then went on to even become lifetime smokers because of the addictive property in e-cigs.
Wonderful. And then I think we have time for one more.
Okay.
And this is about parents who are finding that their children are vaping. Do you have any advice for parents who have just recently learned that their teenager is vaping?
So that's a great question. Actually, I'm getting this a lot, actually. And remember why? Why are we getting this? Because it's amongst that population. That's who we're seeing this great big rise amongst this demographic of these teenagers who are starting to smoke. I think education. I think we were having a talk with one of our coordinators here, and they were saying that their kids started e-cigarettes and vaping. And she brought up, oh, it's linked to some issues, you shouldn't do it. And they're like, oh, no, I use Juul, And it's just another brand that markets to kids. And so education, informing them that these are all different brands that do the same thing, maybe taking home some of these points today and the links that we've made today and going over it with them and even showing them that, again, we're reliving history, and that was what happened with cigarettes back in the day, and you don't want to be in that place 40 years from now.
Yeah, very true.
And using some of the same resources with cigarette use and abuse with e-cig users. So I think that would be helpful.
Yeah. Well, we have one more that just came up.
Yeah, great.
It says, is there any advocacy efforts going on in the legislative side of things? And I think you sort of touched on this with the FDA, but it's talking about limiting flavors of e-cigarettes that target children.
Right. Yep, and that was what I released on that one of that chart. Yeah, that's it. Yeah, we need more, and don't get me wrong, and it's taken a lot of time to get to this point, and there's the healthcare providers are really pushing for regulation because we're starting to see this early bench research, and it's showing there's risks to e-cigarettes, and we just don't want to find ourselves, remember with cigarettes, 60 years from now, making medical claims that it causes harm. So there is, and again, that was regulating flavor. Remember, because flavoring is the part that we're just so unknown. We know a lot about nicotine part, we just don't know about the other parts and chemicals that are in these solutions that people vape. So regulating that's a good step. And then regulating access, and that's where FDA has really stepped up and trying to regulate the age group, having a license available. And again, it doesn't always create an access barrier for people. If they want it, they're going to get it. But it at least creates red flags for people who are selling it.
Okay. I think we have time for one more question.
All right.
And this is from a healthcare provider, and she says, what are the arguments to someone that has picked up vaping in replacement of smoking traditional cigarettes when they say that they can see a difference, they can breathe better, their cough is gone, and they can walk upstairs easier?
Right. So it's a dilemma I see every day, and I think it's a real dilemma. So there's a lot of studies out. So one of the big questions I get is, well, can e-cigarettes help you quit smoking? Well, theoretically, all the studies combined so far haven't come up to a conclusion decision. In fact, there are studies that show e-cigarette use actually creates more cigarette smoking, or a combination of the two, which is more likely that cigarette smokers will try to do both. But there are several studies that show that e-cigarettes do have side effects, but to a lesser degree than cigarette smoking. So can I say, those are real? They probably do breathe better. They probably have less symptoms with e-cigarettes, probably. But I wouldn't trade one toxic product for another. And I would encourage that patient, like I do every day, try the products we have. Try the therapy. Try the things that we have. These are proven, the slide I showed you with the options that we have now, they're proven to help. When a patient is motivated to quit, which in that patient's case, seems like they're motivated to quit. They want to get away from cigarettes. Give them the good, healthier options, and that should help.
Thank you so much for your time today. I know you're a busy man.
This is great. I think it's a great topic.
Yeah, thank you for tuning in today. That'll conclude our presentation on vaping and lung cancer. We want to bring your attention to our next Cancer Conversations webinar. That'll take place in January, Friday, January 25th, and we're going to be talking about when cancer runs in your family. We'll have a genetics counselor with us. So that is all for today, and if you have any follow-up questions, please don't hesitate to email. We'll continue to answer those over the course of the next couple hours. Thank you. Thank you, Dr.
Yeah, thanks, guys. Thank you.